So how does glaucoma affect vision? Glaucoma affects the far periphery of a person's vision, meaning it kind of affects way out here first. So people don't know that they have glaucoma unless they've come in to have an eye exam. Then slowly over time, it starts to affect the center of the vision. And so when people start to notice glaucoma is usually when it's much more advanced. So it's more severe. One of the first things that people will notice sometimes is they'll say when they're walking downstairs, they're missing stairs or their depth perception is off. Sometimes they'll say that they were driving and all of a sudden they didn't see the car right next to them, or they were walking down the street and they didn't realize that the curb was there and they ended up having a fall. Those are sometimes when people have more advanced disease, how I end up seeing them for the first time. A lot of patients will come in just for a regular eye exam. Maybe they've even had cataract surgery and their vision is just not as good as it used to be. And that's sometimes because glaucoma has started to affect the center of the vision. So they're changing glasses all the time and they still can't get great vision. And sometimes it's because there's something else going on. So what is the difference between glaucoma and cataracts? Cataracts are in the front of the eye or in the middle of your eye, and glaucoma is more in the back of the eye. Cataracts are the lens that you're born with. It's the window that sits in the middle of the eye. As life goes on for everyone, it starts to grow and get bigger and cloudy. So getting new glasses or contacts doesn't help to improve your vision because you're looking through this cloudy lens. Everyone will get a cataract, and most people in their lifetime are going to need cataract surgery to improve vision. Glaucoma affects the optic nerve, which is actually in the back of the eye, and it's typically an anatomical reason why a person gets glaucoma, or there's a family history, and it affects peripheral vision first, and then it starts to affect the center of the vision. And glaucoma is when the pressure in the eye is too high for that person, and over time, if it's not being treated, it will cause damage to the vision. But two totally separate things. So people can have glaucoma and not cataracts that need surgery, and also the other way around, but they're very different entities. Will glaucoma affect reading? Yes, if glaucoma is not being treated and it has progressed to affect the center of your vision, you may notice that reading becomes very difficult. Patients who have advanced glaucoma often will see someone called a low vision specialist who can actually provide you with special kind of reading glasses or other tools to help you read better or use the vision that you have left even better. But of course, untreated glaucoma or glaucoma that's progressing will affect reading. Does glaucoma affect both eyes? Typically, yes. Sometimes people will present as a new patient because one eye has much more advanced glaucoma than the other, and that's actually very common.